Hi, so I got another question from a patient who's asking about what's the best anti-reflux procedure for somebody who does not have a good motility of their esophagus, meaning their esophagus does not peristalsis to get the food down easily. So first, let me explain what esophagus is. Esophagus is the tube that connects the mouth down to the stomach, so the food goes through the stomach. Now, the most common cause of reflux is usually presence of a hiatal hernia, which means part of the stomach is pushed through the diaphragm into the chest cavity, and that pressure change causes reflux. Other causes of reflux can also be due to the sphincter that prevents reflux naturally in the lower part of the esophagus. So part of the workup that we do before we do any sort of anti-reflux procedure, one includes a pH study or Bravo study, which we evaluate to see how much acid reflux you're having daily. The other study that we obtain before the procedure is offered is called manometry. Manometry is a tube that goes down through the nose, down to the esophagus, into the stomach, and evaluates the effectiveness and the motility of the esophagus. And this is probably one of the most important tests that we do before we do any anti-reflux procedure, because there are many other motility disorders that can present symptoms like acid reflux. At the same time, I do use this information to offer the best available option to my patients. Because the motility of esophagus is very important. The physiology of esophagus is very important in managing reflux. So this is a reason that we do this test. So if we do the test and we determine that you do not have a good motility of your esophagus, meaning your esophagus is kind of weak and it's not pushing the food all the way down, typically for patients like this, there are still options. So one option is to just fix the hiatal hernia and do not do any sort of wrap. Now the options, let me explain what are the options that are available out there right now. So one option is fixing a hiatal hernia. Now if there's a hiatal hernia with any procedures, we would want to fix a hiatal hernia, because that is one of the most important steps of this anti-reflux procedure. Now, how do we tighten up the sphincter? So one option is doing a Nissen fundoplication, which means we wrap the stomach, upper part of the stomach, 360 degrees around the esophagus. So when we do that, that creates a second valve that would prevent reflux. Now, if somebody doesn't have a good motility of their esophagus, sometimes we do a partial wrap, which means it's not too tight around there, so esophagus can still push food against that sphincter that we just created to go down into the stomach, so you don't experience any symptoms of difficulty swallowing. One of the other options that are available is called Link's procedure, which is a series of magnetic rings that goes around the lower part of the esophagus. Typically, if there's a hiatal hernia associated with the reflux, we'll fix that. And then if you're a candidate for that, meaning you have a good motility and you have a good peristalsis of your esophagus to get the food down, then you would qualify for Link's procedure. There's also another procedure called TIF procedure, which is incisionless, and it's done all through the esophagus. And that procedure, again, it's creating a partial wrap, but it's only good for somebody who has a very minimal or no hiatal hernia. So there's not one operation that's perfect for every patient. And this is the reason that we do all these tests, to determine which operation is going to give you the best long-term outcome. And this is why it's important to go to somebody or a surgeon who understands physiology of the esophagus, understand the physiology of the stomach, and who does this all the time. So long term, you're getting the best results. And do this once and you're done. Now, if it's done right, nothing's ever 100%, but what I would say is close to 90-95% of patients will be off of their medications, reflux free, and don't suffer from symptoms of acid reflux and are able to eat the type of foods that they had to avoid before. So going back to the question again, so if you do not have a good motility of your esophagus, there's still options. We can fix a hiatal hernia sometimes, depending on how much motility is there. We may be able to do a partial wrap to address the reflux. Now, if there's not a big hiatal hernia, sometimes a TIF procedure is a possibility. But Link's procedure would not be an option for somebody who does not have a good peristalsis of their esophagus. So I'll be happy to answer any of the questions you may have, and keep posting the questions, and I will do my best to answer your questions as they come through. All right, thank you.